If you've got lower back pain, rehabbing is so important. It's proven time and time again in the research. And in this video, I'm going to go through a few of the basic conceptual points around rehabbing your lower back, something that we find works fantastically well for patients here in the clinic and something that you can benefit from in this video today. So if you've got any questions, make sure you bang them in the comments below and we'll be sure to get back to you. So first and foremost, when you've got back pain, first port of call, the main thing we get patients doing here is improving the flexibility in this lower limb, getting those hips nice and loose, glutes nice and loose, hamstrings, hip flexors, etc. Because if your hips are a little bit more mobile, then your lower back's going to be used less. And I've used examples, if you've seen any of our other videos of having a sprained ankle or something like that, if you sprained your left ankle, the last thing you want to do is be hopping on it. So having your spine able to stay in this nice neutral position while your hips move about to give you mobility is really, really helpful in the short term. So those stretches are ideal. The second thing we get you doing around about the same time is learning to engage these core muscles, be that the hip flexors and the deeper core muscles, your internal, external obliques, your transverse abdominis, learning to re-engage those. A lot of people that have recurrent back pain, and if this is you, pay close attention, you just don't have control over those core muscles. Patients come in and they're unable, without a bit of coaching and coaxing, to actually engage these muscles correctly. You just use the diaphragm to draw the tummy in rather than those core muscles. So teaching a patient to get the basics right first. The next stage is then adding in a bit of isometric loading. So having your core working, off weight bearing, and then pulling you in a few different directions. So there's some awesome exercises that we get patients doing in the clinic that are done at the right time. Because if you haven't got the foundation there first, and able to engage that core, then doing something like a dead bug, which is a fantastic exercise, lying on your back. There's a video of this on our YouTube channel, so check it out. We'll try and put the link in the description here today, so you can have a look at that. But doing that exercise is completely and utterly useless if you're not able to engage your core effectively. And we get patients sometimes, they started a little bit prematurely, and they're just wiggling the leg around, and it's doing nothing for the core. So getting the foundations first is really important. So we've got the stretches, but the core engagement, and then isometric loading, and then we might do a few additional exercises, things like abdominal rotations, where we've got a neutral position for the spine, it's nice and upright in the most stable position, and we're just slowly putting a bit of rotation just to provide some stability through that midsection. Okay, going through there, giving the body time to recover, time to adapt to that stress, time to get those muscles to learn how to activate. And then we start a little bit of load bearing stuff. So that might be using some of the bands that we have in the clinic, and you can buy them online, not expensive tools, but fantastic tools nonetheless. And that involves holding that spine in a nice neutral position and challenging it from different directions. So we learn how to hold that spine central and not get it pulled off to the side. For example, if you've got a nice strong midsection, if you miss a step, your body instantly responds to protect your spine, catch yourself and back up you can. The person that doesn't, their spine is like a sack of potatoes. They miss a step and all of a sudden, all that movement goes to the spinal joints and re-aggravates an existing injury or causes an injury in the first place. So we have to build the ability for your body to hold that spine centrally and neutrally whilst forces are pulling in different directions. And then the final stage is building out a little bit of load bearing. So that might be using things like kettlebells, stronger bands to really challenge those muscles in a very, very integrated way to really get the body moving together. So be it squats with a kettlebell, single arm deadlifts, those sorts of things with conservative weight, and then slowly allowing the patient to build it up. So just to review that, we've essentially got that hip mobility work first and foremost. Then we've got a bit of core engagement, learning the actual the choreography around engaging the core and feeling it properly. And then we've got some off-weight bearing isometric exercises that are static holds or kind of semi-dynamic holds, whereby we're holding the spine in a neutral position and then pulling it from different directions on the floor. Then we build that up to a few more dynamic exercises, upright with load bearing, putting a little bit of load on that spine through gravity and getting the core to function with things like lunges, things like wood chop rotations, which we've already discussed in this video, and then finally building it up with weight, more strong bands, possibly the use of kettlebells as well to put a bit of load through that spine and help it learn how to resist that load effectively and keep the body nice and strong. So I hope you found this video helpful. If you did, please share it, tag someone that might find it useful that's struggling with back pain. Put some comments in the comment section below if you've got any questions. We'll be sure to get back to you, and just make sure you subscribe to not miss out on any future videos like this. And remember, if you're in the London area, you can always reach out to us. We're more than happy to help you.